Good day, everyone. I am Ronald Carshon March from the Malaria Program. Today, I will be presenting the topic, overuse of post-operative antibiotics at the Bo Government Hospital in Sierra Leone. There was no data on surgical site infections among cesarean section and hernia operation patients at the Bo Government Hospital, and we needed to know whether pre-operative antibiotics were correctly administered. We carried out a retrospective cohort study using hospital data from 681 patients who had surgery from November 2019 to October 2020. Data from theater registers, wound dressing book, and individual patient medical records were collected and analyzed. Our key finding was that antibiotics were incorrectly given after surgery to 85% of cesarean section patients and all of the hernia operation patients against WHO guidelines. Ampicillin, metronidazole, and amoxicillin were mostly used and at a high risk of resistance. Surgical site infection rate for cesarean section patients was 7.5%. So there's room for improvement in hospital infection prevention and control measures. Overuse of antibiotics after surgery promotes the development of antibiotic-resistant microbes, and there is a risk of spread to others. The laboratories lacked the capacity for specimen culture and sensitivity, which risks antimicrobial resistance. The lack of continuous surveillance of surgical site infections and antibiotic use cannot inform policy and practice. The Bo Government Hospital Management Committee should firstly establish a hospital antimicrobial stewardship program. They should also educate surgeons, obstetricians, and surgical community health officers on WHO antibiotic treatment guidelines, optimal prescribing, and rational antibiotic use. They should urgently improve the hospital's record and information system. We also recommend that the National Antimicrobial Resistance Committee review the National Antibiotic Treatment Guidelines and work with the Laboratory Directorate to strengthen laboratory services for culture and sensitivity tests. Overuse of post-operative antibiotics must be controlled. Antibiotics are not an alternative to good infection prevention and control. I want to thank you all for your attention.